Hey everybody, we are marking 100 days since the very first confirmed COVID-19 case in America. And over the span of the last several weeks, we've gone from one confirmed case to more than 1 million in the United States. In fact, 1 out of every 3 confirmed COVID-19 cases on the planet is happening in the United States right now. So I thought this would be a great opportunity to take a deep breath and sort of reflect on what we've learned and why it matters. Got my notes, so here it goes. Let's start with the name because I think that's really important. The name of this virus is actually SARS-CoV-2. It causes the disease COVID-19. The World Health Organization came up with COVID-19 to stand for Coronavirus Disease 2019. And they did so, they say, in order to avoid a stigma attached to a certain place or a group of people. Remember, at that time, many were referring to this new coronavirus as the Wuhan coronavirus, referring to the city in China where it's believed the first outbreak started. Knowing the virus name really matters because even if we don't use it very often, it's important to know that it is very similar to the first SARS outbreak. In fact, Dr. Michael Lin of Stanford University said it's about 96% identical. And the reason why that matters is you have to think about it, he says, sort of like a movie sequel. Yes, this is original content. It is a new virus, but there is a foundation that we know something about. And that foundation will be particularly helpful to researchers as they learn how to treat this virus. Needless to say, this virus and the disease it causes is just full of contradictions. On the one hand, the virus is very strong. It is extremely contagious, even more contagious than the best and the brightest minds even anticipated. On the other hand, it is actually very weak. It can easily be broken apart using soap and water and just washed down the drain. Strong on the one hand and being very contagious, weak on the other in that you can kill it. The virus has both common symptoms and then more obscure symptoms. For example, we've talked about these symptoms from the beginning: fever, cough, shortness of breath. But along the way, other symptoms like stomach trouble has become more commonly talked about in relation to this virus and those who are most sick. This virus survives on many different surfaces, very similar to the first SARS virus. It survives best on smooth surfaces like stainless steel or plastic, one of the reasons why we're often wiping down a lot of our groceries. But just remember, evidence of the virus on a surface for a particular length of time does not directly correlate to how contagious it is. So when you see a flashy headline about how long this virus lasts on something, just take note that that doesn't necessarily connect to how contagious it will be to you if you happen to touch that surface. You may have noticed that we haven't mentioned the exact number of deaths, and there's a reason for that. One of the reasons is by the time you watch the video, the number will already change as it's increasing every day. But more importantly, I have a real issue with the way that the data often is read in the news. These are real people. This is a real loss for families, and there's no way that the numbers accurately represent that. So I want to give you a little context for the numbers. We have lost about as many people in the last 100 days as we have lost in the most recent flu season, with the highest estimates for death. So just think about it that way. Flu season was actually twice as long, but we've lost about the same amount of people. One notable pivot in this story is the complete and total reversal of health officials' guidance on wearing masks. We were told initially to not wear masks, that they actually would not make us safer. And now we're being told that we should wear masks because it will make us all more safe. Watch this storyline because we are seeing companies require their employees to start wearing masks, or now their customers. JetBlue soon will require passengers to wear masks on their planes. Where else would this start happening, and will it just become the norm? What have you learned in the last 100 days, either about the virus or about yourself, that you feel has made you smarter? We have had this really interesting opportunity to share in this experience together in this very unique historical moment in time. I'm really curious to hear your feedback, so comment below. On a personal note, what I'm going to try to do over the next few days is write a letter to my children about what this last 100 days was like for me as a journalist, but also me as a mom, because no matter what happens in the next 100 days, what we've been through is historic and it matters. Take care, guys.